All right. Okay, good evening, everyone. Very, very nice. I see there are multiple attendees here. It's 6 o'clock on the dot here, so we're going to get going. Today, we're going to be talking about developing an integrated mindset, in the face of all that we're dealing with right now. But first off, I like to just say, I like to run these for about 30 minutes to a half hour, 30 minutes to a half hour, 30 minutes to 45 minutes, something along those lines. If at any time you feel like you need to leave, no worries about that. If at any time you have a question or anything, just try to drop it in the chat and I'll do my best to sort of try to answer it or add to it when I'm in between a slide a little bit, so I can sort of collect my thoughts a little bit and so I don't get a little bit lost or more lost than I usually am. And so today, without further ado, we're going to be talking about developing an integrated mindset. My name is Jacob Meyer. I am the psychotherapist that works in congruence with Dr. Stedman, Dr. Perry, and Kate along at Integrated Health Systems. And so this presentation, this webinar today was developed a little bit in the face of, what we're dealing with as a nation, also how this response and these principles I'm going to be talking about today, um, how they can help us sort of switch into a growth mindset and sort of contextualize our ability to utilize delayed gratification, a series of stress that we go through, things of this nature, so that we can become stronger in the face of it, stronger in the face of the unknown, stronger in the face of discomfort, and we can truly grow and develop into that. And so, just sort of moving forward a little bit here, a little bit about me. Again, my name is Jacob Meyer. People typically call me Jake. And just a word about my licensure before we get going here. So, working on my LCSW, which is just your general clinical licensure, your sort of general therapist that you sort of expect to talk to and sit down with. In addition to that, I have a licensed addiction counseling certification, which is a master's level addiction counselor certification. And so my background sort of lies in that. I started cutting my teeth in this field, in the field of addiction, working up in Westminster at a methadone clinic, and really was trial by fire in that situation. I really was able to learn an incredible amount. I was able to experience a lot, and I'll typically tell a lot of patients, especially patients that come and sit across from me at Integrated Health Systems, that hey, there's nothing you really are going to be able to tell me or surprise me with. There's no way I'm going to really have a big judgment for you. I've sort of heard it all, I've seen it all at this point, and that time really helped me develop a lot of my thoughts about things like delayed gratification, pleasure versus satisfaction, working in trauma, working with shame. A lot of these elements came from sort of growing my experience, working with patients that were struggling with severe opiate abuse, severe methamphetamine abuse, severe benzodiazepine, alcohol, you name it. I've helped to treat it in that way. And it was a very, very intense environment to begin in this field, to say the least, in that. And so my background is focused a lot in working in addiction and trauma and people with very, very severe needs. And that sort of helped feed into my role at IHS. And my role at IHS, sort of dealing with an addiction or dealing with trauma, we're coming into the realm of dealing with things like chronic illnesses, traumatic brain injuries, things of this nature. A lot of these things align typically a little bit more than people would think. Chronic illnesses are extremely disempowering. This is one of the major things that we see. Disempowering to the level that it can cause a lot of anxiety, a lot of rumination, a lot of dealing with the unknown. And it can cause us to feel extremely sad, extremely disempowered, extremely isolated, misunderstood. And the same thing goes with traumatic brain injuries. A lot of people, the expectation in our culture along with chronic illnesses that don't have a clear root and are not easily definable in the purely Western model, general practitioner model of medicine that a lot of people encounter. And so, what a lot of people don't understand is how very isolating and shameful these things can become. The long scale, the long way of people having to deal with these things in their life, and just the really the lack of understanding, even by their close friends and family members, the frustration they experience for people being upset at them not recovering, things of this nature. So, my background working with addiction and trauma, those things are chronically occurring, typically over the course of, this starts in someone's development. It gets exacerbated as the person experiences more and more stress. And our old coping mechanisms just simply start to not work anymore. And so in integrated health systems, my primary role, like you'll see me first when I'm doing a half hour informal assessment. And that's when I'm just sort of assessing and educating the person on, my services there, seeing what's bringing them in, but also most importantly, what my main role at integrated health systems is assessing someone's emotional health and their level of stress and determining and giving a recommendation based on its relationship to their overall recovery. So what's very, very common at IHS is that you might have someone who is suffering from an autoimmune issue or chronic illness, a thyroid issue, and they're a very high achieving human being. They push, push, push very, very hard. And it's very, very hard for them to be able to take a step back and deal with stress. And they don't really understand how stress and chronic cortisol and adrenal release can really sort of ravage our body in the long term in that way. They get stuck in what we call sort of a sympathetic dominant system in their nervous system, and their body has a very, very hard time being able to actually get into that parasympathetic system, or ability to rest and digest. So my main role at integrated health systems is to work with Dr. Perry, Dr. Stedman, and determine whether someone's emotional health might be holding back their overall recovery. The way that their body experiences stress might block them from states of recovery, and to try to work and partner with the person in that way for individual psychotherapy, or through being able to give sort of psychoeducation sessions and guided sessions on being able to learn mindful breathing techniques to access that all important, that very, very valuable gateway through our breath into our parasympathetic nervous system in that way. So working with the team every day there, it's a high paced environment, and we really like to look at the entire human being and the constellation of the stressors in their life to be able to treat them as a whole in that setting. So really love my work there, love the team, and we're finding a very effective approach in that as well. But sort of moving forward into what we're going to be talking a little bit more about today and giving you the overview of this presentation today is developing this integrated mindset. It probably sounds pretty redundant that someone from integrative health systems is putting out something called developing an integrated mindset, but it's such a great name. I can't ignore it. There's so much to learn and to grow from this. I think this mindset, so much of this is seeping into the culture. I think as sort of an undergrowth of our culture is sort of learning more and more how do we deal with the problems that we're facing and the sort of the chronic stresses that we face as a culture as well. But part of the big inspiration for this is, just the seeing people just really at a baseline, let's say before like mid-March happened with COVID-19. I'm really experienced with dealing with people who deal with consistent stress in their life. And in the past, it's weird to even think that that was 3 months ago when all these restrictions started taking place. But in the past 3 months here, the life has really changed in an unprecedented level. Uncertainty and stress have by far been the norm. And there has been no real recent time in history that people have had to deal with such major cultural stressors, such as, I heard it said on a podcast that we're dealing with the Spanish flu, we're dealing with the recession or depression, and we're dealing with the civil rights movement all at one time. These things were major stressors, major changes within the culture that were experienced. But we're sort of dealing with it all at the same time right now. And people are getting hit with a level of stress that has not been seen in the recent past. The thing that I think compares to it the most is when America experienced what happened on September 11th, 2001. And I don't think anything has really even come close to that since then, and probably for years before that as well. So this time right now we're in, it's hard because it is. This is a very difficult time our culture is going through, and depression, anxiety, and suicidality, things of this nature, are unfortunately are all very on the uptick. They're all very up right now. We were dealing with a culture that was already struggling with elements of isolation. And isolation is almost impossible to cope with. We as human beings are interdependent creatures. It simply it does not work for our optimum health and development, in our mental health. Isolation is something is extremely corrosive to a human being and their well-being in that way. We're we're a culture that, we're seeing before this, in March, February, before this time that hit us right now, we were already dealing with a lot of chronic stressors like isolation. We were already dealing with mental health issues. We were already dealing with a lot of stressors within the culture. And this has simply exacerbated a lot of that. More stress added on to a culture that was struggling with some dysfunction in its baseline in that way will only become more dysfunctional over stress. The system is simply overloaded in that way, and people are really suffering and feeling those effects right now. And that's the funny thing about human beings, and when we think about them as we deal with stress, is that we can actually handle a lot of stress. We're very, very designed to enter into that sympathetic nervous system. What I often say is that, because I talk about the importance of parasympathetic access and dominance in our system, that rest and digest state, that very valuable state where all of our higher human behaviors, our logic, our reasoning, our mindset, being able to put ourselves in someone else's shoes, just basic things like that. We access that when we're in that rest and digest, our parasympathetic nervous system. But we can actually deal with an incredible amount of sympathetic fight and flight activation. Now, what I'll tell people is that, if you're up there walking in the mountains, and a bear or a mountain lion happen across your path, I definitely want that sympathetic system to activate that fight and flight. In the short term, there is nothing that will protect you like your body's response in that way. It's very, very designed and honed in to perceive threats within our environment and to respond with physiological changes that reflect with also psychological changes that take place in that state. But the issue with that is when this chronic stress, when we get chronically activated into that sympathetic state, when we're not able to shut off from that. And that is particularly damaging and corrosive to the human being over time. We might see the person sort of processing and understanding and taking in a lot more threat from their environment when they're not actually experiencing threat. Their threat detection system can be a little bit off, and they might have a general feeling of unsafety within their environment. They might have a low grade element of hypervigilance as well. So chronic stress is something that simply will wear a human being down until mental health or physical health issues will present. There is simply no way around it. And human beings can really thrive when they deal with a more novel stress in that way. I'm going to talk a little bit about that in the following slides. But when we're able to encounter an unknown in our environment, a stressor, when we're able to investigate, hey, what is this? What is the effect of this? When we're able to experiment, what can I do to affect this unknown? How can I understand it more? And then as we succeed and come through from the state of the unknown, the state of stress in that way, to the state of the known state, then we feel very satisfied. We feel very calm. We're able to enter back into that parasympathetic, that rest and digest dominance within ourselves. And a quick example of this would be getting used to a job. getting used to perhaps a new set of friends, going to a new airport for the first time. These are all very stress inducing situations. We don't fully understand our environment yet. We don't know the actual layout, and it can be very confusing and novel to deal with that. But we know that over time and repeated repetitions, we're able to sort of process that unknown, investigate strategies, know where to go, know what the hot button things are, and experiment with this environment, and then sort of have a feeling of success with, okay, I know I shouldn't talk about this with this person, or to get to gate 32, I need to go this way. I better get to the airport probably 2 hours before if I'm driving and need to, let's say, park in the shuttle lot. There are a lot of ways that we start to feel more satisfied and comfortable in our environment. And we're able to deal with stressors in a positive manner. And sort of moving on to the second aspect of this is um, utilizing the integrated sort of mindset to understand what is a growth mindset, what is cutting a path and being able to use things like delayed gratification to our overall benefit. How can we embrace the discomfort, the stress of the short term in that way, and delay our gratification so we can have long term success? So we can find these pathways, we can cut them ourselves and feel very satisfied about that process. And there is a cost to cutting the path. There's nothing comes for free in this. It takes a lot of consistent effort and a lot of willingly putting ourselves sort of in a state of discomfort to be able to grow and to move into a new direction and to increase our level of understanding. But I think one of the real things I want people to take away from this today, because we're going to have a lot of principles that I'm going to put out here today. I'm going to try to give some examples, just like I did just before, but a lot of this is principle based and will need to be applied in your set environment in that way. But understanding this process, this growth based process, this growth mindset, the integrated mindset in this way, can help us really manage and contextualize feelings of inadequacy and shame. A lot of people feel like they're a failure maybe when they feel like they did something incorrectly. They're not able to learn a skill. And that discomfort there can be a real barrier to their continuation in that process. And helping them to understand that failure, discomfort, stress, shame, it's all a part of this process. And a lot of times it can really key us into we are heading in the right direction. If I am uncomfortable, if I am stressed to a reasonable degree, I know I'm pushing my mind, my body, my overall system into a state where it's in that sort of yellow zone and not quite in that red, not quite in that green, but I'm challenged, but I'm not overwhelmed, but I'm able to feel a lot of discomfort here, and my body is being forced to adapt to a new situation. And so there is a cost to this. It is uncomfortable, but there is a lot of value in delaying our gratification and applying that to multiple situations and ways of being within our life. And sort of the last aspect I'll cover today is the concept that this is a very simple concept, but simple is not easy. Simple is putting one foot in front of the other. I'll cover that a little bit more later. But we need to be able to find balance with a growth based mindset. And there's a lot of people that will, you'll talk to them about a breathing technique, you'll talk to them about maybe a new strategy to communicate, and they get very, very excited. And all of a sudden, our relationship with shame and perfectionism start affecting our growth based mindset in that way. People put very rigid expectations on themselves. They feel like they have to do that. They'll even feel like they failed in front of me, or they failed me as my patient. But this is something that we need to find balance with as well. And so simple is not easy. Entering into this discomfort, I'm always going to have that disclaimer of when we enter into discomfort, there is a cost to that, but we want to be able to see past that cost into the greater gain that we have. And so learning to flow and balance, things like instant versus delayed gratification are going to be key in this, in sort of being able to understand the value of entering into discomfort, but also knowing like, hey, sometimes that is just a little bit too much and it might not be valuable to be in that red zone. Or if I'm going to be in that red zone, then I might need to recover afterwards. And so we'll continue on with that. But first, I see there is an attendee chat. And this is from Allison. When we must be in contact with others, there seems to be more conflict as we have different opinions of what is safe. This is when we need to calm ourselves and when we need guidance. And thank you very much, Allison, for that comment. That is very, very true. A lot of people don't really understand how important their use of language and body explicit language in the spoken sense, but also very, very importantly, our body language is a very, very powerful indicator of our signaling to others of not only our internal state, but the safety of their internal state around us. And people, one of the most meaningful things I think we can do as a human being is to present ourselves in a calm manner to promote the felt sense of safety in other human beings. And this is because, quite simply, is that we simply don't know what other people have been through. You know, I go through this in my profession all the time. When I do an assessment with someone, I literally have no clue what this person is going to say, what they've been through. And in order to help the person explore themselves and to feel comfortable in that space, I need to be as calm, cool, and collected as I can possibly be. A lot of self-care goes into that, and a lot of sacrifice goes into that from my end, but with the overall goal to be able to help others feel safe in my presence so they can feel like they can explore these difficult emotional states and feel validated and non-judged in that. So, Allison, really great comment there in that differing people have differing opinions of what it means to be safe. And also, this is a common clash that we see in friend groups, in the workplace, and things like that. And so, moving on here, you know, and sort of being able to dealing with consistent stressors here and diving a little bit more into that. And the main thing here is that uncertainty is the opposite of routine. Human beings really tend to thrive in routine with smaller breaks of uncertainty. So we're able to really hone in and focus in on our ability to keep returning and getting 1% better all the time, to be able to make those consistent connections, that slow growth that we're able to do if we're in a routine environment. And one of the reasons that a routine environment is so valuable is that it's so valuable in its stability. We're able to forecast what our week, month, year, etc. will look like. We can plan out, okay, I need to work on these days, I need to focus for this long, I need to recover for this long, and that gives us a very consistent rhythm that we're able to work in, and we're really able to build upon routine and to focus our mind where we want it to go in that way. And so routine really allows us in that way to optimally focus where we think our precious resources of our mind should go. And so a good example of this is decisional fatigue. I sort of brought up the airport earlier. Everyone who's been to an airport or flown in a day, you always think it's going to be something like, well, I'm just going to hop on this plane. I'm going to get to the other side. It's not a big deal. All I really need to do is sit down at the right place. But at the end of the day, because of oxygen, things like that up in the air, the cabin pressure, but also because of decisional fatigue, we're in a novel environment. We're not particularly familiar with what's going to happen. We don't know what we're going to eat. We don't know really what to expect with all these people around us. And so our brain is making a lot of these little decisions that we're not used to making. And that really contributes to our sense of fatigue in that way. And so another good example of this is a smooth running morning versus a chaotic morning. A big thing that I work on with people is, you know, when they're feeling disorganized in the routine is, you know, how are you waking up and how are you starting your day? How are you prepared for your day? And we can all think of a morning where, boy, our hair was just being pulled every which direction because we thought we had breakfast and we didn't. We thought we had the clothes we wanted and we didn't. It's a struggle just to get out that door. And by the time we get to work and what we need to focus our mind with, we're already our candle's sort of half burnt in that sense. And so being able to smooth things out into a routine allows us to save that cognitive energy to put it where we most optimally want to put it in that way. And so what we've been dealing with as a culture is the opposite of this routine. And coronavirus has brought uncertainty on multiple levels. Our daily, monthly, now even yearly routine, we're still reeling from the effects of this, is affected by the continuous changes that we're experiencing. And this stress really comes because now we're forced to engage ourselves more frequently in our daily decision making. And people are really perceiving the near future as a threat rather than as a challenge to ourselves, rather than looking at how are we going to seize the summer, how are we going to have the most fun, how are we going to connect with people, go to concerts. Now we're thinking, well, how much money do I need to save because this recession might be coming? Are these riots going to spell out into where I live? Are people going to continue to riot where I live? Am I going to be safe in my neighborhood? All of these things, all of these stressors that were occurring are very, very overwhelming, and they're really interrupting our normal routine, our daily, monthly, and yearly rhythms that we all know and understand. And so, stress is this normal occurrence, and everyone really experiences it to some degree. But it would simply not be natural to be affected by this stress. Um, at dealing in I'm getting my words a little bit twisted here, but we're dealing with the stress on a really unprecedented level, and that this is not normal to what we're going through, and we're really trying to find our new normal as we're coming into this time as well. And again, I want to reinforce that novelty is typically the best in smaller doses. It helps us sort of switch things up. It helps us to experience smaller intolerable levels of uncertainty because it really can stimulate our mind. It's engaging to us, being able to go to that new place, that new restaurant on a Friday, being able to meet some new people, make some new connections. This all opens up new possibilities and interests for ourselves. But this novelty, this uncertainty simply requires a lot of cognitive energy, and it requires a lot of attention. So we can see in certain levels, this is very dose dependent. This is very beneficial for our lives. But as it increases and increases, we are creatures of routine. We want to be able to expect things, to use the power of our mind to forecast our day, month, and year in that way. And being disconnected from that really stresses us out as a people. So, what I really want to impart onto people is that the stress that you, your family, your friends are experiencing, it is all very normal. And people who were struggling with some dysfunction in their life in terms of things like anxiety, things like depression, this is stress that is laid on top of a system that was already struggling. So we're simply just going to struggle more in that sense. And so this sort of leaves us, and this is what really inspired me to respond to this a little bit with developing this notion of an integrative mindset. And so we can take all these stressors that were happening recently, and we often can understand people's sort of relationship with stress. People feel like things are happening to them. Why is this happening to me? This is very, very unfair right now. And we know that certain people have different relationships with stress, and their ability to manage and to grow from that uh, typically will result in more or less a more successful human being over the long term versus the short term in that way. And so an integrated mindset is a way to think about how we can deal with stress. This stress, this pain in our life, these things that are simply things that we cannot separate from the human experience. And so, this is an outlook, the integrated mindset, that seeks to really use internal or external stressors as a way to drive internal growth. And maintaining this mindset allows us to continuously work towards optimum health, both in our mind and in our body. in that way. So we're basically taking a stress that hits, and rather than reacting to it, feeling very frustrated, maybe being angry, maybe feeling that life is unfair, we're able to respond to this a little bit more. We're able to say, why is this stressing me out right now? What do I have to gain from this stressor? How can I use this discomfort for increased growth in that way? And so, the real crux of this and what I want people to understand from this is that the integrative mindset allows us to embrace or join with stressors, discomfort, pain that we experience in order to grow more resilient in the end. And so, we are embracing discomfort in the short term. We are curious about that as well. And we are looking at that as an opportunity for further growth in our life and in our development into our psychological resilience. And stress is something, and discomfort is something that's talked a lot about in the therapeutic world. I would say, especially in the world of treating addiction, where I come from, stress experience, both voluntarily and involuntarily, are necessary catalysts for growth in that way. Discomfort is a primary motivation for change that we see. If everything is going good in your life, why do we need to make a change? That is simply not how human beings typically work. But if we can start to voluntarily embrace stress or voluntarily even look for stress to expose ourselves to that, then we can catalyze growth from that. And so how I want to start breaking this down is integrative responses versus disintegrative responses. And so an integrative response is combining the experience, the stressor that is internal or external, into or joining with it into our overall sense of wholeness in that way. A disintegrative response is the opposite. It's splitting from the experience stressor that is internal or external from our overall sense of wholeness. And so, an example of an integrative response would be something like dealing with a surprise. Something hits us, something happens within our week. Perhaps that we worked Monday through Friday, and our boss might tell us, hey, you got to work Saturday. Or for our business owner, hey, this thing came up and we have to work Saturday. And an integrative response would note and respond to, hey, I'm upset, I'm feeling uncomfortable. What might I have to do to understand this situation right now? Is this a reoccurring situation I'm dealing with? Is this something I need to plan for next time? What can I gain from this opportunity right now, from this discomfort? And how can I delay gratification in this moment to sort of see the overall picture and how I can develop from this? Versus this integrative response, which would be that surprise comes, we react to it, we reject it, we avoid the discomfort, we blame other people for it, we blame parts of ourselves. We might experience a lot of shame and say, why does this always happen to me? What is wrong with me in this way? Just a couple of little examples to sort of uh, give a little bit more light on these principles right now. But when we integrate something into our understanding, it's going from pain, stress, unknown, things of that nature into our sense of overall awareness and hardiness in that way. And something that, and this integrative response is something that stays outside of ourselves in that way. We are not able to integrate it into ourselves, and we are split from that thing. And then so what I want people to understand is that when we experience the stress, when we embody, when we embrace these stressors, this pain, this discomfort, we are really finding strength. We are really saying that this is hurting me right now, but it will make me stronger in the end. And that we can really generalize our understanding of delayed gratification in multiple settings. And what you'll notice a lot of times is that people with, like, it's typically, the cliche is, once you find the way, you know the way to all things, or something like that. And so once we find a way to deal with stress in a pure sense, once we find a way, especially when people find this is when they're adolescents and they really find out that they have a knack for something, they're able to develop a special type of skill or knowledge that other people don't readily have. And they find the sort of the way through that process. They're able to integrate a lot of things down this pathway. They're able to continue going, and what's feeding them is their passion, but they're really finding out how to get good at sort of everything. They're finding the way to all things in that manner. And what I really want people to understand is that this is a painful process, but it is very, very empowering in that sense. We are cutting a path. We are doing something different, and we will become stronger in the end if we can consistently um, place ourselves sort of in this crucible and take sort of step after step. And so that's over to this next concept of sort of cutting this path. And the example I like to use is sort of cutting a path through the woods is what it literally takes to symbolically develop in that way. Our conscious mind being the tool that we wield, along with probably like an axe and other route clearing tools in that way. But if we could think of our conscious mind in the symbolic level and the level of principle in this way as a tool, and we wield it with the understanding that, hey, this is going to hurt, this is going to be uncomfortable, we may fail, we may feel frustrated, we may lose motivation, things of this nature. But if we continue, what we will win in the end is a greater sense of satisfaction. And so, why this is a good metaphor is that once this path is cut, it's very easy to travel up and down this path. We have something that we created that we can now utilize for ourselves in that way. And we are able to associate this very act with satisfaction because we have been able to tangibly overcome our present discomfort for the greater goal. And so, examples of this overall process and, excuse me, how it sort of applies, let's say, to the therapeutic process is that I have someone that comes in and is very, very confused about their emotions. They feel like they're the only one that's dealing with this. They're really struggling at home to communicate how they're feeling. They're feeling lost. They're feeling very, very disempowered. And me, as sort of a guide through this process, I help bring them into this discomfort. I help bring them into this unknown. And through the strength, trust, and rapport built in the relationship, the person is really able to associate this pain and discomfort that they have with kindness, care, and compassion. They're able to grow stronger through the help of another in that way, to be able to cut a path sort of in their own mind and to understand themselves on a deeper level, why their brain is ticking like this, why things bother them in this way, and that probably what they're going through is pretty normal and pretty reasonable for what they discover about themselves. So just a little example about how this integrative mindset sort of applies to the therapeutic setting, but it applies in all changes that we make, really, and in pretty much every setting you can really think of as a human being. And sort of moving on to the next, I'm sort of yakking on a little bit here. We're at 37 minutes, and I got a couple major slides to go, so I might speed myself up a little bit. But to really understand right now that this is simple. If we're able to delay gratification over a long period of time, we will simply grow. If we place, let's say, a plant in the correct conditions, we are simply going that plant will grow no matter what based on these principles. It just needs the proper environment to really be able to thrive in. And so this concept is simple, but simple is not easy. And this really can't be said enough. And usually, again, I was discussing this earlier, when I speak to patients or people about these concepts, that there's an excited response. They feel like, I have this pathway. I know the benefits of delaying gratification, of embracing discomfort, and they typically will leave full force into whatever they're doing, typically like a breathing exercise, on talking to a spouse, having a difficult conversation with a spouse, and they'll come at it with sort of a rigid expectation, a sort of a reaction versus responding to that, to the way, to the pathway, to the integrated mindset in this manner. And so a good way to sort of illustrate this is simple is sort of climbing any of the 14ers in this state. All we have to do is put one foot after the other. And as we can see, if you start visualizing that in your mind, that this is not easy at all. It's actually very hazardous. That you're exposing yourself to a lot of danger. But what is the key here is the consistent repetitions that are the key to success. Being able to pace ourselves up that mountain, being able to know our terrain in that way. The air is going to be thin. We need to come prepared so we can execute this step after step, sort of pounding after pound, cutting this new pathway towards the top where we can delay a lot of gratification and really feel strongly satisfied at the end of that process. And so I'm going to talk a little bit more about this importance of pacing. And finding our pace is so very critical, and it's probably one of the most important elements of this process. If we're going to start delaying gratification, if we're going to start laying these foundations, if we're going to start cutting these pathways, if we're going to start embracing this discomfort, we need to understand that there are limitations to that. I sort of alluded to a little bit of like that green, yellow, and red zone, and that's very important in understanding the concept of like individual therapy. My job as a therapist is to bring you to that place of optimum discomfort, a discomfort that you're able to tolerate and to recover from reliably in between every session, so you don't associate the process with that red zone, with being overwhelmed, with feelings of despair, not feeling in control during your week. And so this is one of the most important things I want people to take away is that discomfort is a good thing, but too much can really sour us from the process very quickly. And if we notice, one of the concepts I like to work with is compliance, building compliance over intensity. Compliance needs to come first in that way. And so every single year, we all have this example of we're working out at the gym, or January 1st comes and we really want to get in shape, and we see people that come and start working out. They're focusing on intensity over compliance, and those people simply aren't there come February, come March, come June. These are the people that, if you value intensity over compliance, you will simply burn yourself out, because we are not in an optimum place of discomfort. We are in that red zone. We're not able to sustain that, and we associate something that has long-term health benefits with something that's intolerable to our systems. And so if we can think about it, the person who's going to be more successful going in January will simply probably just go to the gym and be able to warm up, maybe do a 20-minute workout and go home. And if they can do that 3 times a week, it might not feel like they're doing much, but they're focusing on compliance. And when we can build that compliance, that slow pacing, that's when we can start adding things like intensity. That's when we can start ramping it up, because our body will develop and sort of adapt to that stressor. And then if we start feeding it a little bit more, those 3 days we're going to work out can probably grow into a workout that takes place over an hour and a half. And remember, we can generalize this principle to other aspects of our life. People are able to, let's say in the course of individual therapy, they're barely able to speak about something like their childhood. They're barely able to speak about something like a difficult relationship that they have, a difficult boss that they have. But over time, in building comfort, increasing our distress tolerance in that setting, we're able to push deeper and deeper and get to those real roots of why they're presenting to individual therapy. And so what we're really trying to understand with these concepts is that we're really trying to utilize the present discomfort that we're experiencing to build for tomorrow. And we do not need to sacrifice the present completely to build for tomorrow, but we can utilize it, we can harness it, we can sit with that discomfort of the present to forge pathways that will simply be more useful for us in the future. And so we need to find this balance in multiple levels. In the short term, what does my day-to-day look like? What does my medium term balance of stressors go forth in terms of our month to month and maybe our long-term goals of our year to year. Finding balance with this is extremely critical for our overall growth and development. And if we're able to understand these concepts and apply them in our life and sort of go with that slow pacing, that consistent pacing, we're able to get a lot more in over time. We're able to grow and sort of put ourselves into different situations as well. And so, a little bit, those are my main points today. And I just want to talk a little bit about the benefits of psychotherapy in terms of this integrative mindset a little bit before we sign off today. One of the biggest benefits of psychotherapy to me is that you're really starting to go through your own journey. You're really able to come into a setting where you're saying that I don't know what's happening to me. I've tried everything I know, and I need help right now. And you're able to identify really what is wrong, move towards acceptance in that, and able to grow through the process to be able to grow through that setting in terms of, again, building trust and being able to explore yourself further in front of a trusting another who's helping to guide you through that process. And I'm very, very big on developing this integrative mindset. I'm very, very big in trying to help people to find competence in the unknown. And a lot of times, what people will hear from me is something like, it's okay to not be okay. It's okay to be confused. It's okay to not know what's going on because when we're in that state, we're in that first stage of knowing. We don't know, we're confused. But if we just continue to move forward towards that discomfort at a reasonable pace, in a way that we can tolerate, we're really able to become stronger from the process. It's really amazing to see the amount of transformation that people go through right in front of my eyes of their emotional landscape and coming to points of they're coming from states of fear, confusion, shame, depression, anxiety, to feeling a lot more joy, self-acceptance, self-compassion, self-understanding, forgiveness of themselves, forgiveness of family members that have hurt them in the past. And they're really able to come out the other side far stronger than they felt before. And that is something I think we try to drive home a lot in integrative health systems overall, is that we experience patients that are in the end of their road in care. A lot of the Western model and general physicians have simply not worked for them. A lot of people that we work with experience um, they're accused of lying by medical professionals. They're accused of lying by family members, close one, loved ones. They're feeling a lot of isolation from that. And when they come to integrative health systems, all of a sudden, okay, you're being, first off, it's a very kind and nice environment to be in. It's an environment that bedside manner is taken very, very seriously there. And patient care is very, very serious in that environment. We really try to make people feel safe, but we also validate people's experiences as well and seek to understand what their symptoms are in a very nuanced level to give us clues to be able to help them through this process with the knowledge that we have developed over time. And so, what Dr. Stedman, Dr. Perry Maynard will talk about, what I'll talk about with each other, is that it's really surprising to see just how strong people can become after they're feeling at their lowest or weakest point in life. It's really awesome to see when we get patients that are highly motivated, our treatment protocols work, and it just seems like everything's really firing on all cylinders. And that person leaves a happy, healthy, and a vibrant self and far stronger than they were before, and they understand themselves in a far stronger manner in it as well. Excuse me. And so, what we're able to really utilize the benefits of psychotherapy for as well is finding what we can control versus what we can't control, and to understand that what we feel like we can control is typically in reality a lot less than what we can actually control. And that in the things that we actually can control, we can learn to cultivate feelings of flow and sort of in rhythm with. We don't have to be in control in a rigid sense. We're able to really flow and feel and become more sensitized to what is that feeling that's actually coming up. where does that feeling come from? We can sit in that discomfort of that feeling with an open, responsive mind and be able to safely investigate that for sort of the deeper level of knowledge that we're after, something that's not readily conscious, not readily available, and is typically embedded more into our past and unconscious mind in that way. So the benefits of psychotherapy really to me, I mean, I'm a very large proponent in becoming stronger, not weaker, developing, gaining strength, growing, learning from experience, and utilizing therapy as another avenue to help someone become the strongest that they can become in the face of all the unfairness and the cruelness that people experience in the world as well. And so here are just couple more general benefits of psychotherapy that we have. One is that having a very experienced guide, again, from the beginning. I have really, I've heard it all, I've seen it all at this point. I'm trained to be responsive to chronic illnesses, addictions, traumas, you sort of name it. And I'm trained to approach these in a kind and compassionate manner to help the person integrate these experiences and help them to become stronger overall. So having an experienced guide is very critical in this process. And I am extremely committed to giving people the best experience they possibly can have in the therapeutic setting so they can get to where they need to go. They can learn what they need to learn and they can move on within their life as a happier and healthier human being. The second thing being is that really beneficial to be able to learn from within. I am simply, again, I am a guide. I'm not making anyone do anything. I'm sort of sitting. I'm dropping in with this other person and going to places within them and helping to guide and shape the experience. But I am not in charge of the experience whatsoever. The patient is always the person who is determining what is happening. And my role is to be responsive to that and to try to cultivate an experience that is beneficial from them. And so the burden is really on the patient in that regard to learn from within, to investigate and push themselves in that manner. And no one is going to be a better teacher about yourself than you. I'm always curious. I'm learning all the time. I do know some things, but I am far and will never know everything in that regard. And I'm always seeking to learn from my patients as well in that manner. And the third thing is, again, that this integrated mindset, that this concept of stronger, not weaker in this way, and regaining or strengthening the self through this process, being able to take all these things, these experiences that the person has gone through that have pushed them to the point of, hey, I really need some professional help right now. I'm not feeling okay. I'm feeling anxious. I've suffered from trauma. I don't know if this is normal. And to help them come in and go from a person that's scared and confused and is feeling a lot of shame to a person that is feeling stronger, they feel more competent, and they feel like they're really able to navigate themselves and empower themselves through this process. And so those are just a couple of the general benefits of psychotherapy. A lot of people have the conception that this is something that, people just come to cry, people come to get sympathy, people receive empathy for their experience. But by no means is this just a place for us to be upset. This is a place for us to really be able to confront, to be able to integrate, and to be able to become stronger in the face of a lot of the unfairness that we've experienced throughout our lifetimes. And so, just as a conclusion to start wrapping things up in these next couple slides, I put a lot of value judgments on this process, and I truly believe that we can and we should improve our emotional well-being. The stronger that we can become as individuals over our life cycle is the equals to me the more help we can give to others in our life, and that this process it's a lot of responsibility for someone to bear, but this is something that I definitely try to espouse in my practice, and I try to take on that burden of putting myself in that crucible as well. And this is really hard because it's not fun come in and talk about something that's really been bothering you or something that's even hard to think about. It's very, very hard to develop and to embrace an integrative mindset where I'm basically asking you as patients, as attendees, as curious people right now to say, where is something that's uncomfortable in your life that you can deal with? How can you move forward and embrace that? How can you see the bigger picture in that and move through that discomfort for the overall gain? That is not a fun thing that I'm asking of anyone at all, but I ask it of people, I encourage it of people because I've seen so many people go through this process. I've helped guide so many people, and I have an understanding of these principles in what works in that way, in embracing discomfort in the short term. If we can learn how to do that, it can really free us so much as human beings to be able to go down so many pathways that we did not know that was possible. And another thing is that in this climate, mental health is at an all-time high in its acceptability to talk about your struggles, the acceptability to go to therapy. But we simply as a culture need to keep working on and progressing towards being frank about our emotional health. It's simply not okay to me to suffer from an emotional ailment that is preventable, that is treatable, and that really affects the loved ones around us. It's sort of like if you have a broken leg and just refuse to get it treated, we can say that's pretty wrong. We could say that's going to be detrimental to your health, but then we get into sort of this sensitive area where it's not okay to say like, hey, we need to be frank about our emotional health. We need to get treatment when we need it. We need to move through that process and so we can live a happier and healthier and stronger life as well. And so moving on to some of the things that we're doing every Monday at 12:30, we're on Your Health Matters, brought to you by Integrated Health Systems on KLZ The Source, talking with Scott Wadley. Dr. Stedman, Dr. Maynard, and I are typically on there every Monday and do a webinar the following day as well. We're going to try to be branching out into things like doing some Facebook Live and just trying to be more interactive and to sort of have as much contact with our patients or just people that are curious as possible in that manner. So you can expect us to be on there every single Monday, and I believe Dr. Trinka will start doing those as well. We are offering telehealth with the present concerns with COVID-19. What we're doing at the office, we're sterilizing things, we're keeping things very, very clean. We're wearing masks as necessary as well. Also, people's temperatures are being taken, and so people are able to come and receive treatment based on their comfort level. But if that comfort level if you or a loved one are at risk, if you just simply you don't feel comfortable, it's okay to request telehealth services. This is readily available, and we are ready to sort of implement that very, very quickly now with all the pivoting we've had to do as well. And so, sort of in conclusion, you can go ahead and click in the attendee chat here. You can click on the schedule link for and schedule yourself a free 30-minute consultation. You can also call in to Lindsay or Sandy for a 30-minute consultation with me as well. Simply, if you just feel curious, if you just have questions, I would love to chat with you, talk to a family member. There's no strings attached with it, and we like to offer that just to let people get to know us, get to know our process, get to know you a little bit, and to see maybe if you would be a good fit in terms of wanting an overall exam, wanting to just do individual therapy, or just being curious about like what's going on and how this place might be able to help you. So we ran about 15 minutes over today. I apologize for that. I appreciate you all with hanging with me with your evening. If you have any questions or concerns or anything, feel free to sign on for a consultation with me or shoot me an email at jacob@integratedhealthdenver.com. And I think we're going to also try to post these a little bit more and make these a little bit more available for people to listen and like on their own time in a podcast format as well. So you all can expect some changes as we keep sort of chugging along with this webinar format. So again, thank you all very much for joining me this evening. speaking on this integrative mindset. I wish you all the very best in your health and to take care. And if you need to communicate, just simply just reach out. We love to talk to our patients, and we love to just talk to curious people about their health. So thank you all very much for joining me this evening, and you have a great rest of your night. Thank you all. And I see some thank yous from people. Thank you very much for joining me. All righty. You all have a good evening.